Insertion, male patient validation. To start, we're going to verify the doctor's orders to make sure that their order's in place to place a Foley catheter. We're going to first see in the EMR. We're going to come into the patient's room, provide privacy, do hand hygiene, introduce yourself, which will be my name is Renee, and I'll be your nurse for today. Can you please verify your name and your date of birth? Okay, are you allergic to anything? Are you allergic to latex? Okay. So your doctor has ordered a Foley catheter placement. Have you done this before? Okay. So for validation purposes, the sterile kits come in a package, but for this particular validation, pretend this is sterile packaging. You're gonna make sure you open the sterile field using only 1 inch on each side. These are your sterile gloves. Everything is sterile in the sterile field. Once you have the gloves on, you can make any changes if you need to. But do not touch outside rim because it's contaminated, but you can touch the gloves if you need to. This is sterile, this is sterile. So what you want to do is that there is a particular sterile drape that you can put around the penis. Make sure that you put the shiny part towards the patient. Now these are the instruments, which they're all sterile, and it includes the pavadine, iodine, and this is to clean the penis, the jelly, the syringe, which is to inflate the catheter, some cotton balls with clamps to clean the actual penis, and the Foley catheter. What you want to do in this place, get everything ready. You're going to first prep the syringe into the Foley catheter so that it's ready for when you insert it, you can inflate the balloon. You're going to get the iodine. You're going to soak the cotton swabs, dispose of that. You're going to get the jelly. Make sure you put some jelly to lubricate the actual catheter. With your non-dominant hand, you're going to grasp on the penis and make sure that you clean the head of the penis 3 times. Make sure that you use 1 cotton ball per swab. Okay. Now, with your non-dominant hand still in place, you're going to lubricate the catheter. You're going to grab the penis and if they have a foreskin, retract it. And you're going to insert until you see urine. When you see urine, you're going to inflate the balloon, again using your sterile hand. Okay, once it's inflated, what you want to do is you want to pull back. Well, you first have to insert once you insert the catheter, once you see urine, you're going to insert it 1 to 2 inches, and then you inflate the balloon. Once you inflate the balloon, you're going to pull gently to make sure that it's in place. Then you're going to get the Foley catheter, and you're going to the bag, and you're going to place it below the patient's bed, below the bladder so that it can drain. Make sure that when you insert the catheter, if the patient is uncircumcised, you pull forward the foreskin because it can get stuck if it swells up, and this can actually hurt the patient. Make sure the patient is comfortable. Ask the patient if they need anything. They can lower their legs. Everything, you can discard it in a biohazard bag. And you can pull the bed down, pull the sheets down, ask the patient if they're comfortable, assess the abdomen, make sure that the patient is comfortable, and document. You need to document the catheter size. You need to document the way the patient is feeling. You have to document the urine, the color, the odor, the consistency, the amount. If the doctor wants you to do a straight catch culture, this is where you do it. When you do it, make sure that if there's an order to measure at a certain amount of time, the output that is documented as well. And that's it.